From the State House tonight, inequities in healthcare have been brought into focus throughout this pandemic. And now, Vermont lawmakers have introduced a bill that would establish a state government office specifically for addressing those gaps. State House reporter Devin Bates with more.
This bill, introduced by State Rep Brian Chino, would also create a Health Equity Advisory Commission and direct grant money toward the effort. The specifics are still being worked out in collaboration with groups like the Vermont Racial Justice Alliance. In these early stages, lawmakers were more interested in hearing about the data and lived experience of health inequity.
For hundreds of years, many of us have had to learn to take care of ourselves and each other when the system failed us.
We didn't go to the doctor because in the South, especially during my early years, you went to the doctor when you were almost dead or dying.
According to a 2018 report by the Vermont Department of Health, non-white Vermonters are statistically less likely to have a personal doctor and adequate emotional support, yet are more than twice as likely to report poor mental health.
I was getting a mental health evaluation done, and they seemed much more concerned with the fact that I was African American and overweight than they were about the fact that I was concerned about how I was treating my child in terms of my parenting.
Mark Hughes of the Vermont Racial Justice Alliance said advocating for a more equitable healthcare system is at the core of the Alliance's goals this year. He urged lawmakers to share in that goal.
It's a really broad, sweeping conversation. When you talk about wellness, that means wholeness. That's everything. I am confident that this is headed in the right direction. I think there is an imperative. This is an emergency. The House is on fire.
In writing this healthcare equity bill, Pat Attilio, a retired IT professional, gathered data for the Racial Justice Alliance. That process quickly led to another glaring issue the bill seeks to address.
One of the challenges we have with presenting these findings or any data gathering is actually getting the data.
We'll monitor this bill and any potential changes as it goes through the legislature. Right now, if passed, it would go into effect on July 1st. Devin Bates, Local 22 News.